So my topic was on choosing wisely with the focus on radiation oncology. So the way I put it across was more of focusing on radiation oncology practices that align to the choosing wisely perspective, that is effective use of resources. Therefore, there was a greater, more like I addressed hypofractionation, which essentially is using radiotherapy with less number of fractions compared to traditional approaches, whereby the approach was more conventional with more fractions. So you find from a choosing oncology perspective, especially from settings where when patients have to pay out of pocket, they have this is based on number of fractions as well. So when clinicians take advantage of hypofractionation where the evidence base is solid, that also means less fractions, and that reduces the financial burden on patients. And this other second aspect I also focused on was de-escalation of patients. So you find there are certain clinical scenarios whereby traditionally you would use radiotherapy as an adjuvant treatment modality, but with more evidence that have looked at certain specific clinical scenarios, you may actually forego radiotherapy. Therefore, that's reduces also the financial burden and from a time perspective for the patient, because of no value in that particular setting. And on the other aspect, you may look at from a perspective of de-escalation in terms of reducing the number of fields. For example, head and neck, whereby you would treat the contralateral neck in some, some settings, but now with limited evidence guided by obviously the clinical scenario, you may not have to treat the contralateral neck, therefore reduces also the financial burden and even toxicity from a toxicity perspective. So all those aspects you find they align quite well with choosing wisely, whereby we are trying to encourage clinicians to use to make choices that result in better decisions that are made in together with the patient themselves. Yeah, so I think choosing wisely events are very important and very significant, especially from a low middle income perspective. Even when you look at, I think it's even other income levels in general, because you also find that diversity in terms of how how different the populations are even within some of the high income countries. So the events allow clinicians to meet in a space whereby they're able to share their thoughts and encourage each other and see how the evidence base is like, which promotes effective use of resources. So having such events that really focus solely on that draws more attention than having having to discuss some of these aspects in settings where there are a lot of things to be discussed, and you tend to have the choosing wisely campaigns overshadowed by other things that may be prioritized. So I think it's very important to continue having these choosing wisely events that are solely focusing on that only. I think in addition to, the events, the choosing wisely events, which are very welcome, it's always good to have, some of the more like follow-up, follow-up projects that focus solely on, specific institutions or regions, so that at times it helps to see how people are adopting whatever lessons they may gather from these events, to see if it's coming down to institutional level. So it's one of those things that we can certainly think about to have like a greater impact when we focus more on at institutional level.